Hello, and happy Peri-Anesthesia Nurses Week. I'm Barb Ochampaugh, President of NYSPANA, and Trina, your manager, asked me to speak to you today about ASPAN, NYSPANA, the benefits of certification, and my journey to the presidency and my journey for education. And I thank Trina for inviting me to speak with you today. I met Trina just this fall when she answered my appeal to be the New York City President. You are all members of New York City, District 6 of NYSPANA, the New York State Peri-Anesthesia Nurses Association. And you were without a president for a few months before Trina volunteered for the job. And I know she's been talking about that, and you know that she's been planning programs. She also needs a vice president, secretary, and treasurer, and people that are willing to help her set up programs and find spaces. And I know that she's already got the first program planned. ASPAN, or the American Society of Peri-Anesthesia Nurses, was founded in 1980 by a visionary who wanted to provide members with the latest in peri-anesthesia education, research, clinical practice expertise, and advocacy. Through networking and conferences, this mission has continued. ASPAN represents all phases of peri-anesthesia nurses and pain management. Member benefits include receiving professional journals. CPAN is our professional magazine. Breathline is our magazine online. And you can get discount publications on the standards manual, the core curriculum. I'm sorry, I can't speak tonight. As you see, I'm still dressed in greens. And the Ready Ref, which we don't have a copy of that, but it's a little flip book that has everything you wanted to know about peri-anesthesia nurses, and it's kind of like at your fingertips, so you don't carry giant books around. You can also get a discount on the standards manual, the competency manual for nurses and non-licensed personnel. It's a thick book that helps with orientation of new staff. Now, ASPAN is divided into components, and New York State is one of the components of ASPAN. And we further subdivide into districts. And the ASPAN website is aspan.org. And on the website you will find online forums and specialty practice groups, the education calendar, and scholarship information. Your dues to ASPAN include your dues for New York State, and you can be a member of as many states as you want. If you have the money, you can do that. The reason New York State divided into districts is so that we can better provide educational opportunities and networking to our members. New York City is one of our bigger memberships. It includes all 5 boroughs, and you have over 100 members. So that's why it was very important to the board that you have representation and education opportunities. Now, NYSPANA and ASPAN both have annual conferences. ASPAN's this year is in Orlando, Florida, and you may have seen this brochure around your units. It's April 15th through the 19th, and we will be voting on standards this year at our national conference. And Diane Lazard, who is president of Buffalo and also my vice president, president-elect, will be your representatives at the representative assembly meeting where the standards will be voted on. If you are going to conference, you're allowed to come in and see the proceedings and also speak your opinion on the standards. So if you have anything about ASPAN or standards that you need addressed, let Diane and I know, and Trina has my information, and you can get in touch with me, and Diane and I will express your opinions. NYSPANA's annual conference will be in Syracuse this year, which is just a train ride for New York City people. I know a lot of you may not drive. It's going to be one of the last 2 weekends in October. As soon as we have a firm date, it will be posted on our calendar. And the NYSPANA website is nyspana.net. And you can find out who the board members are, what the educational opportunities are, what your district is, who your district president is, the contact information. We and ASPAN both have scholarships. There are scholarships for nurses returning to school. There are scholarships for new nurses in the field for their senior year in nursing school. And each has a Nurse of Excellence application. Our deadline is July 1st for that, and what the Nurse of Excellence receives a free conference and all expenses paid to the conference. So it's very important to nominate a colleague for this award. And as nurses, we don't thank ourselves enough, and it's very important to do this. Now, when you go to the website, this is, where's my book? I'm sorry to turn my head. This is the new brochure that has just come out from ASPAN. It just kind of explains the history like I did, has the membership benefits, so you can get these by calling ASPAN. This is the new membership application. You can either do it in paper form or you can do it online. We also have the Get a Member or Be a Member, Get a Member. The members on both the state and national level that recruits the most members receives a discount on membership fees. Membership fees is the word I'm looking for, I'm sorry. APANC is our certification branch. They develop and administer the exams and keep the records. And there are 2 exam coaches in the state. Online on the APANC website is sample questions that you can take. By being a member of ASPAN, you get discount to take the certification exam. And certification is about prestige. It's about knowing that you are the top of your game. And education and patient care are my 2 advocacies. I've been a nurse for 39 years, and I've always enjoyed my patient care, so that's why I'm in my administrator's office right now. And that's what I love to do, and I love to educate people. And I knew 39 years ago when I graduated from my associate's degree program that I needed to be educated if I was going to stay on top of my game. And that's why education has been a passion of me. In order to pass the certification exam, you will need the core curriculum book. I know it looks big, thick, and frightening, but it helps you with some of the questions. A little bit of book that's easier to swallow is the standards manual, because you will need to know the standards, because some of the questions involve what's the nurse-patient ratio? You've got, a child with a parent on their lap. Can you take another patient? The answer is yes. And I like Drain. I think Drain is very easy to read, but any peri-anesthesia book will do, because you need to know the anesthesia gases, why they use this gas. You need to know your muscle relaxants and those things. So a good peri-anesthesia nursing book will help you study. And there is a review book that you can get that's all questions and answers, and it's a peri-anesthesia review book, and you can get it online. APANC is our certification board. You can either Google APANC and the website will come up, or it's CPAN.org and the APANC website will come up. It gives the deadlines for the certification exams. There will be one in April. It usually coincides with the national conference. And then there's one again in the fall. I never imagined myself as president of NYSPANA. I was studying for my certification exam, and my orientee at that time had just moved up from New York City. And luckily she had the question review book that I used so that I could find out how I got the questions wrong, and it gives you reasons for each answer that's in there, so that you begin to, the more you take answer the questions, the more you realize how you're answering the questions right or wrong, so that you can look for the pattern in the exam. And you don't know if you pass by one question or 100 questions. It's just, I was very fortunate in that I passed it the first time I took it, because you never think that I'd never want to take the exam again. I think as nurses we're not test takers, so you know, I was glad when it was over. And then Sandy said to me, well, where's District 10? How come there are no meetings? So it took us a while to find District 10, and I got elected president. Sandy became the vice president, and now she is the treasurer for District 10. And then when I went to my first board meeting as district president, it's like, oh, there's no way I can be like these women. Had much better leadership qualities than I thought that I possessed. So never say never, because here I am wearing the total hat. But it's kind of nice because we're all seasoned nurses around the board. We're very supportive of each other, and it's very nice to know that if I have a question or anybody emails me with the question and I don't have the answer, I have very educated women around the table, and we have 2 gentlemen now, so I can't leave my gentlemen out, that can get the answers for me or know somebody who has the answer. NYSPANA has been very lucky. We've had 2 national presidents, and also one of our district presidents has been the Region 5 director, so we've got a lot of power around our table. And there are a lot of powerful nurses around the state. And as PACU nurses, we have the ability to be leaders. You know, we advocate for our families and patients. We talk to physicians. So those are leadership qualities. We're organized. So the leadership is in us. And it can be simple things. You can just set up a meeting for somebody. You know, you might not be ready to be district president or even president of the state, but there are little things that you can do to help the organization as a whole. My journey into education began, like I said, when I was getting my associate's degree in nursing. And back then, 39 years ago, the rumor was that you needed your bachelor's to be a nurse. And, you know, family came, and I was too busy to go get my bachelor's in nursing. And then I turned 40, and it was becoming stronger push to have your bachelor's in nursing. And my facility at the time would pay for my education. And SUNY Utica Rome had brought their outreach program down to the Capital District. And my hospital would pay for the education, so I signed up. And it took me 5 years, but I received my bachelor's in nursing. I probably would have kept going to a master's, but at that point my daughter needed to go to college, and the hospital wouldn't pay for a master's because I didn't need it doing critical care. So, you know, I stopped going to school. And then our hospital merged with another hospital, and we went from a 200-bed hospital to a 100-bed hospital. And they were trying to get rid of any of us with seniority. They were calling us at 5:30 in the morning to stay home, and calling us at 5:30 in the morning to come to work if it was your day off. I tried to get a recovery room job at the facility, but there were no full-time openings. So I jumped ship, and I'm at my current facility. Had been at my other job for 23 years when I changed. I've been in my current, I work in a phase 1 PACU. We've got 20 bays on one unit and 4 bays on another unit. And, you know, I love my job. I've been here for 16 years now. 6 more years till retirement. I keep saying that I'm going to retire from here, but I don't know. I've already had to make a change once. You never know if you need to make a change twice. The other thing to consider about education is the bill to make New York State the first bachelor degree state. Hasn't reached the assembly floor yet. It's still in the education committee. And one of the assemblymen is trying to get it out of committee to be voted on in the assembly this year. All of us will be grandfathered in, but you know, you don't think about having to make a career change. You don't think about having to change jobs, but with mergers and, the way the healthcare industry is going, none of us know where we're going to be tomorrow. So it's important to consider education, especially for our younger generation. The other thing about education is, you have to be the top of your game. You need certification, and with magnet hospitals, and I've heard it around the state, I've heard it around the nation when I've gone to conferences, is magnet hospitals hire X number of master prepared nurses, X number of bachelor prepared nurses, associates and diploma nurses. So you may have the longest resume in history, be the top PACU nurse that there can be, but if you go to a magnet facility and they're looking for this degree, there's a good chance you may not get a job. So not to scare people, but it's just something to keep into the back of your head, because you never know what's going to happen. And I know Trina has been trying to tell this to you, and it's happening out there. It's not something that she's made up, and she and I have discussed this. So become certified, become a member of ASPAN. You're patient advocates. You've been PACU nurses for a long time. There's a lot of seasoned nurses out there. Share your expertise with the next generation. We really need it, and help prepare and be a member. It's very important to be professionally involved. And I thank you, and I thank Trina for inviting me. If you have any questions, Trina has my email address. I'll be happy to answer them for you. And reference list will be provided at the end of the video for all the books that I've shown. And I thank Trina for having the courage to stand up and say, yes, I can, and became president of District 6. And I hope that you will be supportive of her and consider becoming an officer or help her with mailings. Thank you, and happy Peri-Anesthesia Nurses Week.